the wherever you want. All right, so I'm going to start with Commissioner Shattuck McNally, who comes from Larimer County, which has already gotten through MJ and others a fair bit of love for how they have really been a model for the state and gotten a head start. You've had the benefit of building on that foundation, but obviously there's a learning process that you've had. Judy, what have you learned as you move forward in this project?
Thank you, and thank you, Attorney General Phil Weiser, for your leadership and your support for large and small counties in that urban-rural divide, trying to close that gap. I think it's been instrumental. We're a very diverse county. We have most of our population on the Front Range, but we also still have some rural areas in the western corner that I have traveled to that I'm wondering, okay, how do we get folks over to services? So as a resident before I became a commissioner, I was very involved with our mental health matters, behavioral health tax that we passed, sales tax. So we had some work going at that time to build a coalition and look at a continuum of care and look at those gaps. And that really, as a resident and someone who's been impacted by suicide and behavioral health issues in our extended family, it's something, also I have my husband works in emergency medicine, so we have kind of a lot of perspectives. And so we just knew we needed to find solutions, and solutions that were kind of unique for our county. So I think we're very, as we learn, we see a lot of people are working in this space, and like with MJ and Coleslaw and some of these partners, we're very fortunate that the work's being done in some of these coalitions, and then we need to join those coalitions and be part of the conversation and look for wherever we see silos and say, hey, come on over, we want to hear from you, we want to learn from you. How can we work together? How can we leverage and blend and braid our efforts and our funding to help with these efforts? And we've kind of done that with the council using some of our behavioral health tax money to blend and braid with opioid abatement.
Well, let me segue to your neighbors, and I take it that Eric and Erin are from Weld. You have this coleslaw initiative that was existing. I'll now turn to you all. How have you, choosing to be an independent region, but still having these close connections to Larimer, straddled that? And how have you been able to build on what you have while also starting in a new model?
Sure.
And please introduce yourself, so your background too.
Okay, sure. My name is Eric Bacco. I'm a longtime public health professional and work at the health department in Weld County. Coleslaw has been around for a long time, and when we heard that we were getting the funding for the region, it was just natural we needed to reach out and collaborate with Coleslaw and with their partners, and then certainly, invite them right from the beginning to participate in deciding how to best spend the funds and what did they need to further the work that they were doing. So collaboration was key to all of that.
So I'll just kind of share a slide that I created, and I think we're going to switch it. It's the key informant interview, key themes. Yep, so my name is Erin Olson, and I'm the Substance Use Disorder Prevention Specialist for Weld County Department of Public Health. I was hired in May, and when I joined in May, I started doing interviews with key partners and people with lived experiences in Weld County. And I just wanted to learn what's going on, what's being done, what's working, where the gaps are. So as you can see on the chart there, I've just kind of broken it down to key themes that we're seeing. With the key partners doing the work, I just asked them what work they're doing. The top themes were harm reduction and Narcan distribution, behavioral health or counseling services, fentanyl testing strips, MAT services, education and detox. I asked them what effective strategies they're seeing throughout Weld County being done. Again, harm reduction and promoting access to treatment were the top themes. Increasing access to peer support specialists, providing MAT, fostering relationships and building trust. And then I asked them what challenges they were seeing in Weld County, Stigma was huge and almost always mentioned. Barriers to implementing harm reduction, immediate access to treatment, working in a conservative community, raising support for programs, and then working with special populations. The last question I asked them is what their thoughts for Weld County Department of Public Health and me in my position, what role we can take. Key themes were increasing the visibility to prevention and treatment work throughout the county, stigma reduction, support syringe access, partnership building, media campaigns, and providing that liaison role between community partners. Next, I interviewed eight people with lived experiences in Weld County, most of who are actually now peer specialists with coleslaw. I asked them what would have helped them seek treatment sooner. They talked about access to resources for recovery, reducing the stigma for the treatment, access to treatment, family education and knowledge of what substance use disorder is, services for mental health, job pathways, sober housing, and early prevention. And then I asked what would have helped them not use. Key themes were increased access to MAT, including cost was mentioned a lot, the need for mentors and trusted adults when they're young, more resources in the medical system, limiting access to RX drugs, prescription drugs, and then youth prevention programs in the schools. And then last, I asked them what barriers they seek for treatment. And almost always it was mentioned the access to treatment, lots of barriers with waiting lists, limited beds. Many mentioned that only being able to be seen when they're in crisis, the cost of treatment, and then the transportation barriers. Access to MAT while they were in jail, the limited hours of MAT clinics, and then the cost. Again, stigma was mentioned many times. Lack of support groups for loved ones with SUD, lack of the syringe exchange programs, and then prevention and education.
Well, that's a thorough mapping. Thank you for that. And if people want access to that, you can follow up with Jamie, your team has a copy as well. And what a theme that's come through these is certain of the regions were well positioned with public health departments and infrastructure, and others are having to build it. In Southeast Colorado, you've had to build it, and Wendy, you've done just an extraordinary job leading in, and Rose, helping facilitate, has been, I know, your partner. Let's start with that project, because it's a big part of the state, covering a lot of ground. How did you work on the relationship building and getting a basic sense of alignment?
The first thing, when we put our region together, one of the basic themes that we've heard throughout the state was that certain organizations are the only ones that got funding. And so we wanted to make sure that they had access to tell us what was happening, but also that nobody could say that certain organizations were getting more than anybody else. And we also made sure that administrative costs stayed low, because this settlement's about the people that have been hurt and getting it to them. So that is one of the things. We have taken the approach in our region. Each county, there's 9 counties in our region. It's one of the largest in the state. 9 counties, we've done 1 vote per county, so everybody has an equal voice and access to the funding. And each county can put 2 representatives, so we always have a backup in case somebody isn't there. And that's kind of what we've done with an RFP. We've asked that people tell us, once we decided on the percentages, and I think you've got a slide that talks about the percentages, that each percentage, we looked at the blueprint, and each one of those sections, we decided at the very first where we wanted to concentrate our efforts on. And that's where we did our funding to each one of the where we could spend the money, and then we decided the percentages. Then we opened it up for RFPs, so the people could tell us what programs were missing in their communities. And that's what we've done. our community, our region has ran up against some education that we need to do for harm reduction. And so we are trying right now to educate and start in, because the last thing you want is controversy in different programs that you're funding. So we've done education, and then we'll move slowly into different aspects of all of it to help people. And I'm gonna let Rose talk a little bit on some of it too, because she's been awesome.
Thank you, and I'll be brief. I don't have much to add to Commissioner Buxton Andrade's comments. I'm Rose Puglisi. I'm the facilitator for Region 19. As the Commissioner said, 9 counties in southeast Colorado, all rural counties, including Pueblo, which is a large county with very rural characteristics. And what I love about my board is their ability to really hone in on what the issues are in their communities. And so they've really focused on out-of-the-box and creative solutions. We've talked a lot about bringing access to the people as opposed to the people getting to access. There's a lot of transportation issues in rural Colorado, especially in Southeast. And so making sure we talk about things like, what does mobile services look like? How do we get the services to the people where they need them? And so we've had a lot of very interesting collaborative conversations around access and really truly understanding what the needs of the people in their communities are. So thank you again for this opportunity.
And then going to the northeast that is, we have Commissioner Scott Weaver and also Leila Kay, who worked together in what was a similar type of project. You guys had to build this yourself. What's been your process, and what have you learned along the way?
I think the first thing that we had to learn, or I had to learn as a commissioner, is when this first came out and we first were told, hey, you're going to get some opioid money. I actually had to figure out what opioid was. And from a rural area, we just didn't realize what it was, and we did not realize that there was an issue. But as we started coming together, and we started getting, we're 10 counties, and everybody started coming together, and we're all realizing, oh my gosh, this is a major problem out here, and this is something that we need to be looking at. And so with that being said, there's times as I go through this process, and especially here at this conference, I start to wonder, why are we as commissioners involved with this? Because we didn't recognize this, and that's why I'm hearing so many people talk about peer support. That's starting to become a huge importance to me through this, because I look at it as a commissioner, okay, we got $1, let's spend $1. But I don't really understand what needs to happen in between those two. And that's why we've partnered with Leah and her team, and we need to start coming up with a lot more interaction with people that are actually involved with it. So we're learning a lot. I have learned a bunch. This conference, compared to last year, I can drink from this fire hose now. Last year, went over the head, but go ahead, Lynn.
Hi, my name is Leila Kay, and I'm from Omni Institute. I'm the director over there. So again, we have the honor to be the facilitator, the researcher, the evaluators for Region 4, which has been great. You were wondering why the county commissioners. I will be honest, in the beginning when all these opioid dollars fell, I had the same question. I work in the substance use prevention field. I've worked for decades now with public health and all of the different community coalitions and the providers. And coming into Region 4, I got that answer really well, in that Region 4 county commissioners work fantastic together. So you've got a bunch of folks come to the table who want the best for their community, have a really strong established relationship, and even now seeing that folks want to take this into this interregional area, and all the county commissioners seem to know each other from every region in Colorado. So I can really see why that was done that way, and I think it really works well up in Region 4. I will just say, one of, I think, the learnings, just to add on to what Scott was saying, one of the things I think they did from the get-go that has been really helpful, and we've seen a lot of positive feedback around it is they tasked us at Omni to do just grant research. What are the grants that are out there already? So yes, they're getting all this money coming in, but they want to make sure that there's more to help support, and there's so much need in Region 4, so many lack of resources. And so they tasked us with doing that. So on a monthly basis, we put together just a real brief summary. We, have some considerations for folks to think about. And whoever is coming to the table in those monthly meetings we have, we're trying to push that information out there. Because the commissioners and everybody on the council board is clear, they're not the ones who have to do the work. It has to be the providers, everybody in the area who has that expertise. So they're just offering up the opportunities. They are offering up the potential letters of support to help these folks get grants. So I just think that was a great learning from my work with the Region 4 Council.
So Scott, I'll go back to you and I'll go down the line and you can pick how you want to answer, which is, what are you really excited about and what are you kind of nervous about in terms of the challenges?
I'm excited to see some of the solutions that come out of this. We just went through our first RFP process. One of the things that we deemed as very needed in our area, because we do not have a lot of treatment facilities, but we needed transportation. So we went out for RFPs, and we have got some really good people that we've awarded these contracts to. I'm just going to point him out. MJ, he's going to be my new rock star for me. So I enjoy working with him. So I'm excited about that. One of the things I'm nervous about is sustainability. And that Alea kind of alluded to that, is what I try to tell my region council, this is seed money. We cannot sustain what we really need with this money. You know what, I often question, this is opioid abatement money. And when it first came out as opioid abatement money, and I understood what opioid was, I thought, we can handle this. This will take care of it. But it has opened up to substance abuse and quite a bit of other. The opioid abatement money, I don't think is going to bring us the solutions that are going to sustain over time. That's why we need the braided funding. We need to be creative. Communities need to come together and support this and wholeheartedly. So that's one of the things I'm nervous about. There's so many of the programs that we start, whether it's through the state or our own communities, that slowly just die off. This is one that if we want a future, we can't let die off. We just can't. So.
Well, and your folks in transportation, this has come up, it's a good theme. There's another infrastructure grant to help support that. Eric, what about you? Things you're excited about and or nervous about?
Can we get that one slide up? For me, as a public health person, it's good data is making good decisions. And what I'm excited about as a person in public health is what's the process evaluation, what's working, what's not, and what do we need to shift if something isn't working. And so we are tracking the data, and this slide it's kind of busy, but if you take the time just to digest it a little bit, we don't have time right now, but we'd be happy to get it to you, is just looking at input from our partners, from the people with shared experience, helping inform decisions within the council, and then when we issue our RFP, which we're going to be doing this fall, looking at what are the gaps and looking to our community partners to address those gaps, and then evaluating what's working, what's not, and then what do we still need to keep doing. So, but again, it comes down to partnerships, and what I'm most concerned about is that we don't become siloed. I don't think that'll happen, but we have to continue to collaborate.
Erin, anything to add to that?
So for me, I'm most excited about upstream prevention. So getting out there and working in the schools on education. And then also Eric mentioned collaboration being a challenge, but I'm very excited about collaboration, bringing people out of silos and hoping to get everybody to work together.
Judy.
Thank you. I'm really excited about a few things. I don't know if we can go to our slide. We have October 3rd, we have a conference coming up, Rethinking Addiction. We're very I'm glad you're sponsoring this. This is our new logo that we may or may not keep, but we're just Region 2. We don't have the cool names like G-Rock and Sword, but hey, council, I want to shout out to our council members, Beth Yance and Sis Park trustee Cindy Youngman, who are here today, and grateful for their passion and their work on the council. I'm the vice chair, and I know that we're really excited to sponsor this, and you're all welcome to come. This will be in, it's actually Fort Collins, it's actually Embassy Suites, MJ, right? And so this is actually in Loveland, on our Laramie County Ranch Complex at the Embassy Suites. And so we're excited to use this as statement reducing and to have opportunities for people to network and learn and to share. And we're really trying to emphasize and get folks out to learn about this and come into this. And then the next slide, I'm really excited about, we did direct funding, and I won't go into that, but our council, we wanted to get the money out the door, and we already had a pretty good idea of where some of our needs were. We're now looking at doing maybe a mixture of direct and RFP with our behavioral health council money. We know how hard that grant process can be. But this co-responder program, we knew they weren't getting into enough calls, and great shout out to Sergeant Cook for all the work that he's doing. But we hope that we took the opioid abatement money we didn't buy a police car, but we need to have a car for the 2 new deputies, and we used the behavioral health money to pay for the clinicians. And so we braided that funding. And now they're also into the schools. And so now Thompson School District actually has a co-responder team that in just a few months is just overwhelmed with the need and the response for that. And so it's really important. And I'm really excited about, we have a lot of great folks like MJ Jorgensen, who's our providers and subject matter experts that come. And then I championed, and I thank the council for supporting having not 1, but 3, and we hope to have more members of lived experience. And I really was intentional to have someone who is a family member impacted by a loss, and then we have a short-term sobriety and a long-term sobriety folks who are involved with the criminal justice system. And we took a whole meeting just letting them talk as long as they wanted, and we gave them questions, and they gave us a lot of thoughts. And one of those thoughts was, one of the long-term folks said, we feel like this opioid abatement money, we know you're trying to save lives, which is really important, but also it's to make amends for those folks who have been impacted. So kind of think about that as you go forward. How are we making amends to the community and to those families impacted? So I'm most excited about our partnerships and our work together, and programs like this, and NJ's program that we're just going to continue to support, and also looking for innovation and being able to pivot, because we know the answers could change. Communities are changing, and we just need to be able to respond to the needs in our community.
So some people want to come to the conference, particularly your neighbors to the east and others, to talk to MJ, talk to you. Great to hear about those relationships. All right, last word goes to Wendy and Rose. Thinking ahead, what are you excited about, and what are you a little concerned about?
Honestly, I'm most excited that this is going to change the perspective of our communities. It is to take the shame away. If people have substance misuse and they have the background, there's a new start for each one of those people. And they are humans. It is not about what the substance is, and they forever have to live in that world. That it can change their world, that they can become productive citizens of our communities. They can help people. It's just like talking about the peers. I mean, these people need to know that they don't have to hide in a closet when they need help, that our community is going to embrace them, and that they can get the help. And that's been the focus from day one on all of it. It's about the human aspect and letting people know that they are worth something and that they can get the help they need, because everybody's worth it, and we don't need to lose another person to an overdose death or anything. And that law enforcement's there, mental health is there, everybody's coming together as a community to embrace, and maybe we can cut down that stigma, and they can help their friends that are doing this, because we need to make them feel they're important, because they are.
Well,
that'll be pretty hard to follow. I was going to say, from a facilitator perspective, I'm really excited that my board wanted money on the street as quickly as possible. We started our RFP processes starting in December and have just about wrapped up those processes. And now for some of our providers, they'll be reporting back to us quarterly, and their first quarterly reports are due for some of our RFPs. So I'm really excited to evaluate from the facilitator perspective where that money went and how it's impacting those communities, and then being able to report back to my board as to where their money is going and see what they're seeing in their communities as well. I did want to put as a quick aside on harm reduction as a concern. Our board has had a lot of conversations around harm reduction, and I think one of the challenges that we're going to face is it's hard to quantify what you've prevented. And so what does that look like as a facilitator talking to my board about, well, here's what we prevented, so therefore it's you should continue investments in harm reduction. So from my perspective, I'm struggling to be able to give my board the resources that they need to make that evaluation. But really excited to work with the AG's office. They've been incredible in helping us navigate the data and really look at some of those services for our communities. So thank you.
All right, let's thank our panel, and everyone enjoy your lunch. Thank you.